Today I will be conducting the physical examination portion of a bedside swallowing evaluation. I will be examining this patient, who is a 70-year-old female who was diagnosed with Parkinson's disease approximately 5 years ago. The patient was referred here by her neurologist after complaining of food getting stuck in her throat during meals. The patient is alert and cooperative, therefore it is appropriate to conduct this clinical swallowing evaluation at this time. Okay, so, hi, how are you?
Good. How are you?
Good. Would you mind telling me what your current feeding method is?
I eat regularly.
Okay, so you eat regularly at home. Okay. Are there any foods that you try to steer clear from, that you have to avoid?
No.
Okay. Do you notice any specific foods that cause the sensation that you feel like it's getting stuck?
Mm-mm.
No? Okay. And how often does that happen?
Multiple times a day.
Oh, multiple times a day. Okay, well, we're going to get this figured out soon. Don't worry. So before we start, I'm just going to put this on your finger to assess your respiratory status. Okay, 94%, that's great. And 15 breaths per minute. Awesome. Okay, so before we get to the actual swallowing part of this exam, I am going to look at a few movements on your face. So I'm going to put on these medical gloves. And, okay. Do you mind looking at me and smiling? Okay, so the patient is very symmetrical at smiling. Okay, and now would you mind smiling and puckering your lips? Smile, pucker, smile, pucker. Okay, great. Now, would you mind opening your jaw and closing, open, close, and leave it open. And now I'm going to apply slight pressure, just see if you can keep your jaw open, how it is now. Okay, great, good jaw strength. Would you mind raising your eyebrows up and down for me? Okay, awesome. And now, would you mind just doing a dry cough? Okay, very good. And now, would you mind sticking your tongue out? And retract it in, out, in. Okay, would you mind moving your tongue side to side, touching the sides of your lips? Amazing. So the patient has good range of motion for her tongue as well. And now I am just going to take out this tongue depressor. And if you wouldn't mind sticking your tongue out, and I'm going to apply pressure onto your tongue. Just see if you can keep your tongue the same spot it is. Almost like you're pushing the tongue depressor away. Okay, great. So the patient has adequate tongue strength as well. Okay, so now let me just get a better look inside your mouth with my flashlight, if you wouldn't mind opening up. Okay, so you have no tongue fasciculations or atrophy. You have adequate saliva production. And do you have any dental implants?
No.
Okay, great, great, great. So now we are on to our swallow portion of the exam. Before we start, I have to double check. Are you allergic to anything?
No.
No? Okay, great. So let's get started. First, I'm going to have you take a sip of this. This is just plain water. This is our thinnest liquid. So I'm going to put my 4 fingers here just to really feel, not yet, just to feel your swallow structures going up and down. I'm going to keep my 4 fingers here for every swallow that I have you do. And whenever you're ready, you can take a small sip of the water. Okay, great. Can you say ah?
Ah.
Okay, and no throat clearing or coughing. Everything went down. That's great. Okay, now can you take a regular size sip of the water? Okay, great. And say ah.
Ah.
Okay, so everything went down again. No coughing or throat clearing. So now I am going to have you try this nectar thick liquid. So this is water, but we put a thickening agent into it. It's not going to taste bad. It's just going to have a different texture, but you shouldn't really taste anything. So whenever you're ready, you can take a small sip. Okay, great. And you can say ah.
Ah.
Okay, Very good. And whenever you're ready, you can take a regular size sip. Okay. Can you say ah?
Ah.
Okay, great. So because there was no coughing or clearing of the throat for any of the liquids, I'm going to surpass the thick liquids portion of the exam and move on to more of the solid foods. Okay. So I'm going to have you try, this is applesauce, so this is our puree, thick food, and you can just take a small bite whenever you're ready. Okay, good, and can you open your mouth? Okay, so the patient was able to get everything down, there was no residual food in her cheeks, which is great. So now I am going to give you a semi-solid food. So this is a fruit cup. Do you like peaches?
I do.
Okay, great. So you can take a bite of that whenever you're ready. And we are looking out for labial closure and mastication. Okay, that was good. And would you mind opening your mouth? Okay, so again, all of the food went down. No residual food in her cheeks. And if you wouldn't mind, this is a rice cake, so we're moving on to solid foods. And you can take a small bite. Again, looking at labial closure and mastication. Okay, great. Open your mouth. Okay, and I'm going to have you take one more bite whenever you're ready. Okay. Again, good lip closure and mastication, which we've seen consistently throughout this physical exam. Okay, great. And would you mind opening your mouth? Okay, no residual food hiding in the pockets of your cheeks. Okay, so we have reached the end of our swallowing exam. You had a very good range of motion during all of the cranial nerve assessments. You had very strong elevation of the laryngeal structures when I had my hands right here, which is very important, so you have good, strong swallows consistently. And so what I am going to do is refer you to a gastroenterologist to possibly assess you for GERD, because sometimes that may give you the sensation of your food getting stuck and you have an issue with your swallow, when really it's an issue with your esophagus. It feels very similar. They're two very close structures. So we are going to refer out there to see what's going on. But you do have a good, safe swallow, so I don't want you to be worried about that at all.
Great. Thank you very much.
No problem.